My name is Mindy Pettis, and I'm a student physical therapist assistant at Jefferson State. Today, I'm going to talk about autonomic hyperreflexia, or as it is also referred to, autonomic dysreflexia. Okay, what this is. This is a serious medical condition that commonly occurs in patients who have suffered from a spinal cord injury, more specifically an upper spinal cord injury. And what happens is that their autonomic nervous system overreacts to any noxious stimuli, and that stimuli can actually be some pretty common occurrences. So causes can include distended bladder, urinary tract infection, menstrual cramps, tightly fitting clothing, pressure sores, impacted bowel, ingrown toenail, and many more. As far as signs and symptoms go, sudden hypertension, bradycardia, hyperhidrosis or excessive sweating, nausea, severe migraine, blurred vision, the appearance of goosebumps, shortness of breath, all of these can be some common symptoms. As far as diagnosis goes, there is no single diagnostic test for autonomic hyperreflexia. So typically a physician would just do a complete nervous system test. I don't know if you can really even see this picture, but it kind of just reiterates what I've already said. So spinal cord injury at T6 or higher, any noxious stimuli below T6, and then the common signs and symptoms. Treatments and prognosis. As far as immediate treatment, this is going to be really important because it can actually be deadly for a patient. You would want to elevate that patient's head and try and decrease that blood pressure, and you would also want to check the cause and eliminate it if possible. So if it's tightly fitting clothing, make sure that you remove that. Check for kinks in the catheter. As far as medications go, antihypertensives and rapid-acting vasodilators are commonly used here. With physical therapy treatment, you would want to follow what you normally would for a patient with a spinal cord injury, because therapy is very important for them. You want to maintain what muscle strength and function remains, and you want to prevent any further loss. But it is really important that the therapist understand AD and also knows what to do if a trigger were to cause any of these reactions. And you want to make sure that any of the stretches or movements that you have that patient doing won't actually be a cause. As far as prognosis goes, it depends on the cause and it varies from person to person. But it's really important to focus on prevention here because all of this is completely preventable. So you do want to make sure that that patient is on a consistent bathroom routine and that they're constantly being checked for any type of trigger. And other than that, that is about it. Thank you very much.